Janelle Fulbright. Yul Anglin.
Here.
Bill John Baker. Jack Baker.
Here.
Harley Buzzard.
Here.
Julia Coates.
Here.
Bill Crittenden.
Here.
Jody Fishenhawk.
Here.
Meredith Fraley. Here. Don Garvin. Hannah Glory Jordan.
Present.
Curtis Snell.
Here.
Chris Boat.
Here.
David Thornton. Kara Cowan Watts.
Honey.
We have a quorum.
We are currently in the middle of report number 3, Cherokee Nation Health Services, Melissa Gower. And
Just housekeeping,
yes,
before she starts. I make a motion that we place Chuck Hoskins Jr. on this committee as a member.
there's, do you have any discussion on that, Councilman?
No, just given the gravity of what we're going to consider, that I will certainly accept it.
We have a motion and a second to add Councilor Hoskin to the Health Committee. All those in favor?
Aye.
Are there any opposed? Motion passes. When we ended, next on my list was Councilor Fishinghawk.
Okay. What am I asked about the robotic machine? You said roughly $500,000. And I asked you how much they save at our clinics when we do install one.
And I don't know that.
Can you get it back to me?
Mm-hmm.
Okay. The other thing, you said we're thinking about putting one at Wilma P? Okay. Within the next year or so? 2 years, 3 years?
Yeah, I
Our
mean,
long-term plan.
we're planning on it. We've just got to do a little renovation to make room for it.
Okay. I asked a question about one of my asked last month. I was wanting the positions available at Wilma P and all the other clinics. How many positions were budgeted at Wilma P and how many are vacant? And then I wanted a breakdown of positions budgeted by clinics and the vacancies at each clinic. Not just Wilma P, and I'm not just saying positions or, you know,
I
practitioners,
sent,
I want positions, all positions, okay?
The response to that is that your budget book has all the budgeted positions in it, and I did send you a list of the vacancies by clinic.
I didn't get the list of vacancies, and our budget book does have it, but when you start turning to the back side of the budget book, it'll say 25% out of here, and then you turn to another page, and it'll be 15% out of here. So I would like it all gathered in neat order so I can just look at it. And the next question I have is about Medicare and Medicaid payment on contract health, because I know I've sent you 2 or 3 questions about contract health people. How do we deny everybody, regardless of whether there's center care or somebody will pay for it, and then they appeal?
Well, first of all, we deny based on medical priority, okay? So if someone goes through the contract health referral process, the approval, there's two issues. One is medical priority, and then there's funding. So we base it on medical priority. So if someone is in the categories that are automatically approved, then we approve those, and those go through regardless of what payer source or if they have a payer source. And then if they're not in those categories, then they're denied. And that's why I always say if somebody's denied, they should appeal it, because if they do have a payer source, lots of times we can work with those vendors to get them to do it for their like if they have Medicare, a lot of our vendors will do it at the Medicare rate. So we can negotiate that with them, and they should appeal that process. But we don't deny people based on whether they can pay for something or not. We deny it based on medical priority.
So when they call me, the first thing I need to do is tell them, file your appeal.
Absolutely.
Okay.
And if they need assistance, have them to go to the clinic where they go to, and the CHS folks there can assist them.
Okay.
Councilor, Madam Speaker Fraley, I had you, during the conversation before we recessed, you had raised your hand, and I didn't know if it was for the motion that you had or you actually, okay.
When I rudely interrupted.
I'm sorry?
When I rudely interrupted.
No, I just want to make sure you had the opportunity. Are there any more questions for Melissa Gower, please? Thank you, Melissa. We are...
And I also brought your original charts back to you that you requested.
Next on the agenda is old business. It appears there is none. Item number 1 is a resolution proclaiming the month of September as Alcohol and Drug Recovery Month within the Cherokee Nation. I believe Councilor Fulbright had taken the lead on that, but I don't see her here. So I will get back to that real quick, if I can find it. Essentially, this is it's beneficial to the Cherokee Nation to bring awareness to drug and addiction recovery methods and to promote all efforts to increase drug and alcohol sobriety and to prevent drug and alcohol abuse. It's simply a declaration of the month of September is to recognize those addictions and recovery methods.
I move for its approval.
We have a first and a second. All those in favor?
Aye.
Any opposed? The motion carries. Next is item 2.
Move to approve.
Second.
On item 2, the resolution ratifying self-governance compact of the United States of America, Health and Human Services, Indian Health Service. We have a first and a second. Is there any discussion? Councilor Hoskin, I believe, Mr. Hember, did you have a statement before Councilor Hoskin?
Well, one thing that I would want to bring to the attention of the council is I would recommend an amendment in the resolve clause. As you are aware, or as you can remember, part of the argument of whether this needed to come back to the council for approval prior to the Attorney General's opinion is that the council had approved such compact, or this compact, in March of 2006. In order to avoid that type of interpretation in the future, if you look at the resolve clause, it states that the Council of the Cherokee Nation hereby ratifies the Compact of Self-Government entered into on March 6, 2006 for Indian Health Service programs, service functions, and activities including WW Indian Hospital, and including all attachment to such compact as they are negotiated from time to time. I would recommend a period after WW Hastings Hospital and strike the remainder of that for the reason that one could interpret the remainder of that sentence to be a prospective blanket approval of any future amendments or compacts to the self-governance document. That would be my recommendation as the council.
Councilor Hoskin, you have the floor.
I'd offer Mr. Hember's suggestion as a friendly amendment to the sponsors.
Councilor Watts, I believe you have the...
I would want to hear from Melanie Knight, Secretary of State, or Chief Smith before accepting anything like that.
Secretaries.
Thank you, Mr. Chair. I just wanted to explain what the effect of that amendment would do. Clearly, the act that we've been talking about that requires ratification of compacts, including this compact, tobacco compacts, other types of compacts, intergovernmental compacts, requires their ratification. The way a self-governance compact works is that there's a compact, which is included in your attachments here, but there's also funding agreements, and funding agreements are attachments to a compact being a overall umbrella document that does not have an expiration date and extends for the life of our involvement in self-governance. It was renegotiated in 2006. The funding agreements are attachments to that compact that outline the annual funding and programs that are being compacted under that arrangement. And to take that phrase out implies to me, I don't know that it says it, but it implies to me that we would need to bring each attachment in the future, which is a funding agreement, separately for ratification to the council. even though it's not a new compact. And so if that is what is intended by that strike here, then I don't think, at least I don't agree with that, because it's not a compact. An attachment is not a compact. An attachment is an attachment to a compact. So we agree that compacts need ratification, but separate attachments shouldn't be separately ratified.
The council actually sees the substance of the annual funding agreement each year with the budget. So the substance of the annual funding agreement is part of the annual budget. So you ultimately see that agreement, or the substance of that agreement in the budget.
Mr. Chair, I also wanted to add that the funding agreements are routinely amended, and they're amended many times throughout the year, up to 20 times in one fiscal year. And so those funding agreements are amended for increases in congressional funding. They're amended when we get new funding for CHS, for different kinds of programs that come down. And I don't believe that the intention here is to come back each time there's an amendment to that funding agreement and get ratification from council for those.
Mr. Henry?
Well, the reason for the language in striking that, or if we need to modify it, was the takeover of W.W. Hastings Hospital was treated as a mere funding agreement of the self-governance compact. And that's what was argued before this council, before the Attorney General, rendered its opinion. I don't think I'll be doing my clients a service if I didn't come forward and say that if one could interpret that this be a prospective blanket approval for any future takeovers of any other self-governance proceedings, self-governance program. And if we need to work on that language, let's work on it. But I guess what I would ask of the Chief and Melanie, let's take any other IHS hospital. If we pass it with that language in there, or are you going to come back and get council approval, or is that just going to be a simple amendment to the self-governance program compact? But I mean, I want to make sure to abide by the spirit of Legislative Act 1501 that says any compact needs to be approved by this council. And anything that has a language that might be a blanket prospective approval, I just, I want to act in abundance of caution.
Councilor Colin Watts, you still have the floor.
Thank you, Mr. Chair. With all due respect, I don't read it the same way, so I won't be accepting as a friendly amendment, but I'm sure you'll offer it as a motion to be voted on.
I'm sure I will. Do I have the floor, Mr.
You do now. Yes, sir.
I agree with Mr. Hembry. I mean, clearly what was at issue a couple of months ago was whether Legislative Act 1501 required the administration to come to this body to get the compact ratified. We were at odds, I think, the administration and the council over what that issue was. The Attorney General resolved that issue in favor of the council's views of it. And if we do anything short of not ratifying it limited to the specific issue, I mean, everyone knows the specific issue is Hastings. And that if that's embodied in the funding agreement, then we can't. I think we have to follow Mr. Hembry's recommendation and strike the language as he suggested. So with that said, I guess I would move to make that amendment. I understand the friendly amendment's been rejected, so I'd make that motion, and Mr. Hembry may need to restate that for us.
Mr. Henry?
Second that.
We have a first and second. Would you state that, please, again?
The amendment would be to put a period after W.W. Hastings Indian Hospital and strike the remainder of the sentence. Now, if there's anything, any compromise language, I would look for that too.
Councilor Hoskin, you still have the floor.
And Mr. Hembry, is there a danger in the word including before W.W. Hastings? Are we saying, does that mean including but not limited to? And is that going to open it wide open for the administration to tack on other plans in the future because it says including W.W. Hastings?
That, I don't have a problem with that language, because the language in and of itself is broad. It says that the Council of the Cherokee Nation hereby ratifies the compact of self-governance entered into on March 6, 2006 for Indian Health Service program service functions and activities, including W.W. Hastings Hospital. I don't see a problem with that language.
And then just to follow up, just direct your attention to paragraphs 6 and 7, two whereases. I mentioned this at our last our meeting a few weeks back. I mean, those strike me as extraneous. They aren't, I don't think, the underlying legal authority for the council to be ratifying this agreement. I think the Attorney General made that clear. So my feeling is we ought to strike those two paragraphs, replace 6 and 7 with what is really paragraph 10, which references Legislative Act 15-01, and revise paragraph 8 such that it reads, pursuant to these authorizations, and strike that and replace it with pursuant to Legislative Act 15-01. I guess the essence of it is state the only legal authority that is at issue here, and that is Legislative Act 1501. Don't bother mentioning the other two resolutions. What's your feelings on that?
Oh, to be honest, I really don't care what's in whereas clauses. You know, they're not enacting clauses of a resolution. It's it was part of the discussion that we had, so therefore I have a major objection to it, whatever the will of the council is. I mean, what's important about a resolution from the council is the resolve clause or the therefore clause. So that's where I would direct my attention.
Well, I don't make that motion.
Mr. Hembry, I've got a question. Not being an attorney, what does the Attorney General's opinion, how broadly does that apply? Because that's ultimately not being of a legal mind. I'm looking at the last part of this that you're suggesting that's stricken. How far does the Attorney General's opinion go as far as what the council has to ratify? Is it just this specific case? Is it, I mean,
Well, I probably should have brought a copy of it with me, but unfortunately I don't. I think the Attorney General's opinion, and correct me if I'm wrong, said that we had to ratify the compact, the self-governance compact. That's correct?
Which we are
Yeah.
not in disagreement over.
Yeah,
Yes.
and so therefore this resolution is ratifying that 2006 self-governance compact. All right. Like I said, the prior argument was that we already did that in 2006, so we could take over Hastings without council approval. And defending the council's position and their legal right of future counties, I do not think that it is prudent to have language that one could say, well, back in 2008, you all said in any other attachments to such compact as may be negotiated from time to time. We don't know what those attachments are going to be. Now, if we can limit it to funding attachments, I don't think that there would be a problem on that. Who?
No.
Oh, okay. Well, then I will respectfully yield the floor.
Secretary of State?
I'd recommend that we leave something like the language that's in there, in the active whereas, that attachments to the compact are be included in this ratification. But what we could say is that provided that any new programs, services, functions, and activities negotiated under those attachments have to come back for new ratification by the council. I think that would address the concerns that we have, that routine amendments, which are done very frequently, in which you all approve in a budget modification, wouldn't have to come back each time, and they number in about 20-some a year. And that probably would satisfy what you're trying to accomplish here, that any new programs, no matter how small they are, would have to come back for new ratification by the council.
Councilman Hoskin, I believe this is your amendment, so you're going to have to...
Okay, well, two things. One is I'm going to lean on Mr. Hembry's advice, and number two, I don't have the precise wording that the Secretary had in mind, but it sounds good. But let me ask Mr. Hembry to weigh in on it.
if we could go into a state of pregnated pause here, I'm working on language.
Mr. Chairman, I'd like to also address the comment about the two whereases that state the legislative history. That's the reason that they are in the resolution. It's because they are part of the legislative history of the self-governance compact, and they did indeed authorize the chief to negotiate and execute a funding agreement, and so that is the reason that they're in here. They're not extraneous to the action, but they state what the legislative history is, which also includes the act that requires ratification, I believe, but they did authorize the chief to negotiate. Is it required in order to do the ratification to have that legislative history in here? No, I would agree with that statement as well. So.
During the pause, Councilor Hoskin, you still have the floor.
I don't have any response to that. I think that ship has sailed, but Mr. Henry.
Madam Speaker.
I had a question for Mr. Hoskin. Are you trying to, is your objective to make it more specific rather than so broad?
Well, with respect to the whereas issues, my concern was we be as precise and as limited as possible as to what is even the legal basis for us ratifying, and it seemed to me that the Attorney General was pretty clear that the only legal basis for us to ratify and the only legal authority that mattered was Legislative Act 15-01. So I thought, why do those prior resolutions even need to be in here? I understand whereas clauses are essentially throwaway lines, for lack of a better phrase, but you know, we could throw all sorts of things in here that are probably not necessary and shouldn't. So.
Mr. Hembry, I know you have a whole semester studied for tests in law school, but how are we doing over here?
We're doing very well.
Okay.
It may need some tweaking, but this is what we've worked on right here during our pregnated pause that now will give birth to this idea. Be it resolved by the Cherokee Nation that the Council of the Cherokee Nation hereby ratifies the Compact of Self-Governance entered into on March 6, 2006 for Indian Health Service programs, services, functions, and activities, including W.W. Hastings, and including all routine funding attachments to such compact as they are negotiated from time to time, provided that any new or additional programs that may be assumed shall require council approval.
Councilor Hoskin, does that meet your...
It does. I agree with that. I looked at my second, too.
Councilor Calhoun Watts, it's your motion to... Go ahead, I'm sorry.
I'm sorry. Point of order, was it my motion and I had a second?
You did have a second here.
I
So
can
it's-
save it all some pain.
Yeah.
It's now Councilor Calhoun Watts, since she has the original first, to accept or decline.
If she accepts it as a friendly amendment, it's automatically made part of, and then you vote on it.
I'll accept it. And my second?
I'll accept it. Friendly amendment's been accepted. We're still in discussion, correct?
I just have one more point.
I've got several lists of councilors. Councilman Crittenden, you're actually next.
I am. I don't know that I raised my hand, but I guess maybe it's a senior woman.
It was a while back.
Chairman. I guess the question I had was on this funding agreement. Have you got a signed copy of this from the Secretary of Health and Human Services?
On the funding agreement?
Yeah.
No, it's been submitted.
You normally get those, so. Okay, well, because this one in the book's not signed.
Right. The compact is signed, but the funding agreement's not in.
So
Councilor Fishingham.
It ain't.
Councilor Coates.
It's moved.
Councilor Callan Watts.
Wait long enough.
Am I called for question yet?
You have the floor. What would you like to do?
I'd like to call for question.
It's been called for question.
What about all of us want to discuss it?
That's a good point.
Point of order, do we have to vote to cut off debate at this point since others want to discuss?
I've got 3 more counselors. I'm going to allow the rest of the discussion. Councilor Thornton.
Todd,
Yeah.
Mr. Henry,
Yes.
I've just got to get one thing kind of clear here. Being that's Indian Health Service program, services, functions, and activities, says it's including W.W. Hastings Hospital. Will this W.W. Hastings Hospital budget and compacts come before the council every year during the budget?
Well, yeah, it will be part of the comprehensive budget.
And we would have to approve that in the yearly budget.
Yes.
I'll send
Yeah, this is, this becomes a component of our comprehensive budget, and it has been submitted in the 09 budget. Is that, that is correct? And, part of the constitutional, duty of the council is to review that budget, make its amendments, and pass one.
It would more or less have to keep up with the Constitution.
Yep.
Thank you.
Councilor Hoskin.
I withdraw.
Do you have any more questions? Councilor Jordan.
Well, as all of y'all know, we amended the agenda today and put an item on as number 3, and I had sent out a copy of that act, which that act goes a little further than this resolution in that it talked about our clinics. And during that time, and I want to ask the Chief Smith, I think you had a discussion this morning with Todd, and there was some change in the wording, is that correct? Essentially, as this act is written now and the copies that have been provided to me, are you of a mind that this is something that...
Councilor, can I ask, are we talking about item 3?
Well, it goes to the vote on item 2.
Finish the question.
The act in its present form that Todd prepared during our break, that you and he had worked out the wording, is this a compromise that you feel admin can live with?
Well, I haven't seen the last language, but
It's the exact language
but
that...
I trust that he took our comments. They're actually, it's not really, I don't know that I agree with your idea about a compromise. The current resolution ratifies that compact. That stands by itself. What you propose, which we have no objection to, but I can't speak for the council as evidenced by last night's vote, is that it goes beyond the scope of the the compact, in that it actually, while we have no objection to it, it actually memorializes to some degree our overall health long-term plan and the need for us to comprehensively look at a long-term capital budget. And the last thing that we talked about, and we talked a little bit about this morning, was that we would have interposed no objections to continuance of IPAs as long as there wasn't a disciplinary issue. So in that, we have no objection to your proposed act. That's true, but I see that as separate, independent, and more exclusive and encompassing than the resolution before you.
And we had a part here, Chief, that included the hospital, so we would probably, if this act, or if this resolution passes, I would assume we would want to delete that from this act, because it would already be in the resolution that it passed.
I think your council would agree that would be repetitive.
Okay.
Thank you. We have a motion, a first and a second on the original, and no more comments. We're going to call the question. The question, I'm sorry?
I have a whole bunch of questions.
Okay. Is that
So are
a,
you calling the question?
The question has been called.
I asked for more,
These are pretty important, I think. but
I asked for more.
I'll not give them to you, Melanie.
I asked for more discussion. If you would like the floor, you have it, Madam Speaker.
Parliamentary procedures.
The question has been called. Now, that usually ends to debate by acclamation. That's after the council has been done. However, it is a motion that is not debatable, not amendable, and can go to a vote, provided that the chair, allows for it. And a yes vote would be to cut off debate and go directly to a vote. A no vote would be to continue on with discussion. So,
The question, is that
The majority vote.
written down, is that a question for Mr. Henry?
There's also another part of that that says the chair's answer can be challenged by any members of the council.
sure, it's appeal to the decision of the chair.
I will just
Do you-
withdraw my call for question. I just assumed we'd had enough debate, so, but I'll
Madam
withdraw.
Speaker,
I don't think we're in any hurry, are we? I mean, is there a timeline or something that we need to be rushed about?
I did think we had to pass it today, but I may have misunderstood that.
I need to go at 3 o'clock, so.
Madam Speaker, you have the floor.
Thank you. If the vote is to, where'd Melanie go? If the vote is to include Hastings, then I do have several questions, and that is the question that's been presented. From some discussion this morning, mine centers around planning. From the discussion this morning, the pattern seems to be that the more money there is for health care, the more patients that we will have or should be able to care for. With the precipitous growth in healthcare costs, have we sought the help or the advice of a health economist? And if so, what was their recommendation?
We did, and Melissa can help me out here, but during the planning process, we acquired the services of a PhD who does healthcare financing as part of he's also a CPA, but does healthcare financing.
Can you speak up?
And yes,
Thank you.
Mr. Chairman. And so he was along with us during the planning process from beginning to end and into negotiations, because he's also very familiar with negotiations with Indian Health Service, which is also very helpful. He's worked on hospitals in both Indian Health Service system and then also in the private sector, and all of that being very helpful to us in healthcare financing, as well as identifying those resources at IHS that at times we didn't know where all the pockets of those resources were, and IHS was not forthcoming always in identifying them for us. So those recommendations were made to us in terms of being able to budget appropriately for the facility, as well as making projections for third party and other types of resources. He's also going to assist us in doing the proposals for the contract support services for the facility, which we're eligible, although there isn't a lot of appropriations right now for contract support, as you know, but we're eligible for startup as well as the ongoing contract support costs. The types of moves we've identified as priorities for year one to free up space in the facility are specifically around some of the issues that you raised, that by freeing up space from the storage there in the facility means you can provide more patient care, means you can get more billing, means you can provide more patient care. And so it is a very circular and interdependent kind of arrangement. And those moves that we've identified for mammography, for surgery, for taking the storage out and so forth are targeted towards that. Where the lowest cost changes that we can make, the most immediate changes we can make that are going to generate more revenue and provide more patient care in the facility.
So his recommendation is?
So those were some of the recommendations that came not only from his angle, but also from all of the planning groups that we had with the people in the specialty areas like pharmacy and like surgery and so forth that made recommendations to us during the planning.
Another, maybe this is a personnel issue, but how do we insulate the staff, the doctors, et cetera, from politics? For instance, an elderly lady comes to the hospital for care. Chad Smith comes to the hospital for care with the same ailment. How do we insulate and I'm not saying that you require that, but how do we insulate the doctors and the staff from that type of political structure?
I think I asked Melissa to address that in terms of operations.
I mean,
That was some
I mean, part of my answer to that is currently we operate a huge healthcare system right now. Okay, we have lots of doctors and lots of nurses and lots of health professionals in 14 counties.
But not enough in Salina.
And that wasn't your question. And I think we do a good job of that now. And how we do that, and we would continue to do that at Hastings, and we've had these discussions, is first of all, I, as the group leader, that's my responsibility to deal with the politics piece. And I try to do that, and I try to keep it away from any of my staff, okay? We're a very sophisticated healthcare system. We have lots of policies, and, we probably have too many, actually. I can show you books and books of policies and processes that's centered around accreditation and all those kinds of things. So we have those processes in place, and the staff follow those. So I guess in short, we would do it the same way we do now, is that we're a sophisticated health system and we don't operate on politics. We operate on what's best for our Cherokee people. It's politics as far as Cherokee people, but I think we do a really good job of that now, and I've never had, as long as I've been in health, I've not had one employee to come and say, you got to help me because the chief's trying to make me do something. They would tell me that because they would know I would go to him and tell him to stop, whether he would or not, I don't know. I would go tell him that, just the same as I do with you all, too.
I think another thing in terms of health that's special, I think, is that the medical care piece, the medical side of the organization is separated from the administrative side of the organization, and then they also have a quality improvement council that oversees the quality of care. And so for medical care, it is really driven independently by the medical side as opposed to driven by administrative whims, so to speak. So,
yeah.
And what is the plan to overcome the people I've talked to said probably it's a good idea for tribes to assume operation of the hospital, particularly from a large bureaucracy standpoint. What is the plan to overcome the results of bureaucracy that overwhelms patients and healthcare providers with excessive paperwork that confuses and frustrates people? And as an example, I took my little 83-year-old aunt to the dental clinic. There were 3 different forms that she had to complete, and they all ask about the same questions. And to me, that's excessive and a waste of time and expense. How do we overcome that?
Okay. Well, I think there's several things that we have planned to work on that's going to help some of those things. One of the problems in healthcare is that before any provider wants to provide care to you, they need to know about you. So they need to know if you have chronic illnesses, if you're taking medication. All those things are going to affect how that provider provides their care to you. It's going to have an impact on it. And so currently, and this is a really good point, and we've talked about this previously, but currently our healthcare, the Cherokee Nation clinics, and only in the last 2 years have done this,